Welcome everyone. I'm Jessie Guglielmo and I'll be your host for this evening. Our presentation tonight is titled Access to Veterinary Care, a National Family Crisis. Before we get started, let's go over a few housekeeping items. Please take a look at the left side of your screen where you'll see a Q&A window. That's where you'll ask questions during the presentation. We'll hold the Q&A until the end, but please get your questions in early because any that are submitted late in the presentation may not be processed in time for a response. At the bottom of your screen, you'll see a green file icon, which is a resource widget. Clicking on that will show you links to the presentation handout, which you can download and print. It also has links to other valuable resources. If you need help with your connection during the presentation, you can click the Help widget at the bottom of your screen. This presentation will be available on demand within 24 hours should you wish to view it again. Our speakers tonight are Dr. Michael Blackwell and Dr. Susan Krebsbach. Dr. Blackwell is the director of the Program for Pet Health Equity at the University of Tennessee in Knoxville. He is also chair of the Access to Veterinary Care Coalition. During his distinguished career, Dr. Blackwell received numerous awards and recognitions. He was formerly the University of Tennessee's Dean of the College of Veterinary Medicine, the Chief of Staff at the Office of the U.S. Surgeon General, and the Chief Veterinary Officer of the U.S. Public Health Service and of the Humane Society of the United States. Dr. Susan Krebsbach is currently the Assistant Director of the Program for Pet Health Equity. Her varied career began as a systems engineer with IBM, which led her to being recognized as one of the nation's top 5% marketing advisors. Her passion for animal care led her to earn a doctorate in veterinary medicine, after which she started her own animal behavior and veterinary practice. Dr. Krebsbach is also honored to be the Executive Director of the Access to Veterinary Care Coalition. Dr. Blackwell and Dr. Krebsbach, thank you for being here.
Our pleasure. Thank you.
Thank you very much. I'd like to welcome you to this presentation. It is actually about a national crisis, which is actually an American story. That story being that millions of families struggle to meet their needs in housing, employment, healthcare, and other areas of importance. Our mission is to improve access to veterinary care. We thank Maddie, whose spirit lives on through the compassionate work of her family. Maddie's fund has been generous in helping to advance the well-being of Maddie's kind. Now, to get us started, please participate by answering a couple of poll questions.
Okay, thank you very much. Our first poll question for the evening is, how efficiently are animal welfare resources aligned? You have a variety of answers you can choose from. 1 is very strongly aligned, 2 is strongly aligned, 3 somewhat aligned, or 4 not aligned. I'll give you a couple of moments to go ahead and answer that. Please remember to answer on your screen and not in the Q&A window. Give it just another second. Okay, let's see what you guys said. So this is our results. It looks like most of you said somewhat aligned. Did you have anything else to add, Dr. Blackwell?
No, very interesting distribution.
All right. With that, we're going to move on to our...
somewhat aligned gives me encouragement about the work we're doing, however. So thank you.
Okay. All right, so we're going to go to our next poll question for you all. This poll question is, what do you believe is the single highest priority? 1, increasing the live release rate of shelters. 2, keeping pets with their family. Or 3, decreasing euthanasia of healthy and treatable pets. Again, please answer this on your screen and not in the Q&A window. And also, please remember to get any questions you have for Dr. Blackwell or Dr. Krebsbach in early so that it has enough time to process. Okay, let's see what you guys answered. All right, it looks like the majority are saying keeping pets with their family.
Dr. Blackwell, that's really encouraging.
That's a very encouraging response in that You know, as we will share during this presentation, we believe that this is of highest priority given where the nation is today. So thank you for your responses.
Before you get started, Dr. Blackwell, people are just asking for a little bit of clarification when you're asking aligned
Yes.
with what?
Well, it was an open-ended question, given that it is a complex system or industry, but basically that we're being as efficient with the use of the resources. That's the main thrust of the question. Are we as efficient in how we utilize resources as we can be, or is there room for improvement? I hope that helps those who are asking. Family
Yes,
has
thank
been
you.
redefined. Thank you. Family has been redefined in that most families today have pets and consider them family members. We call them bonded families in recognition of the human-animal bond. And bonded families are diverse. The image on the left of an unsheltered family is as much a family as the image on the right or in the middle, where children may be a part of the family unit. An estimated 29 million dogs and cats have little to no access to veterinary care. Now, this estimate is based on the number of households that rely upon the Supplemental Nutrition Assistance Program, commonly called the Food Stamp Program. In using that national number and considering the percentage of households that have a dog or cat based on the American Pet Products Association, we estimate approximately 13 million food stamp households or SNAP households that have a dog and or cat. Our recent national study found that there are an average of 2.2 dogs or cats per household. Other national surveys have generated similar estimates. And this is how we derive an overall estimate of the size of the population based upon families requiring assistance with food. Qualifying for SNAP is just one measure of capability to purchase veterinary care. And we make assumptions about this population. Assumptions about the impacts upon the pets and their people, veterinary professionals who wish to help, the animal sheltering system, and the community at large. We believe that when access to care is unavailable or there are barriers, for the pet, it may mean prolonged recovery if they're lucky to recover, or worse, premature death, including by economic euthanasia. And of course, many of you who work in the sheltering system see on a regular basis those family members that are relinquished due to a treatable medical condition. However, the problem is much bigger when we consider other pets in the same SNAP households that are not a dog or a cat. And the millions of middle-class families that live paycheck to paycheck with not much reserve cash to pay for health care. We believe no other issue threatens more pets' being than lack of access to care. And what we want to do is talk to you about what we're doing about it. So now I'm going to ask if Dr. Krebsbach will first share information about the national population study and results recently released in a seminal report.
Great. Thank you, Dr. Blackwell. I appreciate it. Go ahead and advance the slide here. Oops, sorry about that. On December 17th of last year, the Access to Veterinary Care Coalition, or ABCC, released the report Access to Veterinary Care Barriers, Current Practices, and Public Policy via Open Access. This was a 2-year project funded through the generosity of Maddie's Fund. As the executive director of the ABCC, I'm really proud of this work produced by the coalition, which consists of a diverse group of for-profit and nonprofit veterinary service providers, animal welfare and social service professionals, as well as educators. Now, the major sections include results from national population research of pet owners and veterinarians, as well as research targeting pet owners experiencing housing insecurity. We also have scholarly discussions about pets in society, and then considerations for veterinarians. So we'll discuss each one in more detail. The report is really intended to serve as a guide to veterinarians, to animal welfare organizations, legislators, community leaders, and other stakeholders as they seek to improve access to veterinary care. The foreword is authored by Dr. Satcher, who is the 16th Surgeon General of the United States, and he's dedicated his career to eliminating health disparities. He starts out by giving us hope, the hope of keeping families together. Now, this report was envisioned by was really inspired by the vision of Dr. Blackwell himself. In the preface, Dr. Blackwell speaks fondly of his father's wisdom, who was also a veterinarian. When his father was in private veterinary practice, he often told them that providing veterinary care is 90% business and 10% medicine. Dr. Blackwell recalls the many people and their pets who were helped by his dad, but only because he extended credit. Today, we're looking for a better, more sustainable solution. One of the key results were the findings of the National Population Study of Pet Owners. Crafted by the expertise of Linda Dougherty, the study was conducted by the University of Tennessee's Center for Applied Research and Evaluation, or CARE, in partnership with the ABCC. A total of 5,652 surveys were completed using landlines, cell phones, and a web panel, with more than 17,000 households contacted by telephone. In the past 2 years, 1 out of every 4 households experienced barriers to veterinary care. Dogs and cats living in lower income households and with younger pet owners are more at risk at not receiving recommended care. The overwhelming barrier for all groups of pet owners and types of care, preventative, sick, and emergency care, is financial. Another key result, also conducted by Linda Dougherty and her team at UT Care, are the findings of the National Population Study of Veterinary Service Providers. 771 veterinarians completed the internet survey. This study confirms that veterinary service providers recognize the severity of the problem of access to veterinary care and feel a commitment to explore ways to address it. The highest level of agreement expressed by veterinarians in the survey was in response to the statement, "All pets deserve some level of veterinary care." Almost all respondents, almost 95%, either agreed or strongly agreed with the statement. Nearly 9 out of 10 respondents indicated that they agreed or strongly agreed that their own pets are a member of the family. Similarly, 86.7% agreed that not being able to obtain needed veterinary care impacts the owner's mental and emotional health. Many respondents felt obligated to provide the same standard of care to all their patients. About half of them indicated they are worried about professional liability when providing less than the highest standard of care. However, when pet owners cannot afford it, most, 84.8%, are comfortable with offering alternatives. Now, Dr. Rachel Chrysler, who is the Assistant Professor of Shelter Medicine at Midwestern University College of Veterinary Medicine, and also a member of the coalition, conducted associate research of pet owners experiencing housing insecurity. A written survey based on the UT Care Pet Owner Survey was administered to pet owners attending events and associated with 3 geographically different veterinary outreach programs. And the reason this was done is we felt we wanted to reach a population that may be too transient to be readily be reached by telephone or web panel. In many ways, the responses to the survey were similar to the CARE survey. However, these pet owners were 2 times more likely to be unable to obtain preventative care and 3 times more likely to be unable to obtain sick or emergency care. Now, veterinary social worker Serena Manifold, who was also a coalition member, and graduate student Sonia Snyder contributed their insights about pets as family. They discussed how people form the same type of emotional attachments to their pets as they do other family members, and most consider them part of the family. The social support pets provide humans has been demonstrated by physiological benefits such as low blood pressure, fewer doctor visits, and increased physical activity. In addition, pets can provide psychological benefits such as decreased rates of depression, stress, anxiety, decreased loneliness, unconditional love and support, increased self-esteem, and connection to the community. The positive emotional impacts that pets have are particularly important for vulnerable populations, such as the elderly, children, and the homeless, who have a stronger attachment to who may have a stronger attachment to their pets. When owners cannot provide needed care or avoid veterinary services, veterinary services, they are at risk of relinquishing their pets. This is stressful for the entire family. Finally, when addressing barriers to accessing veterinary care, it is important to have a collaborative approach. Social workers trained in human-animal bond can be important team members due to their unique education. David Faber, who is a professor at Michigan State University College of Law and the creator of the Animal Legal and Historical Center, authored the section on animal law. He eloquently describes how the law has evolved with changing societal or social conditions and attitudes. The importance of pets to so many humans has created a political space for enhancing the legal status of companion animals. As a result of this evolution, pets are becoming part of family law. It is now possible to create a trust for the care of an animal after the owner dies in all 50 states. More recent is the enhanced visibility of animals in divorce proceedings. Since 2016, 3 states have adopted laws that allow a judge to consider the interests of any companion animal when determining a property settlement within a divorce. Companion animals are increasingly covered under court-granted protective orders against vindictive spouses. And also, criminal law is becoming more demanding of animal owners. In many states, veterinary care is now required as a matter of criminal law. So as we recognize the importance of companion animals to so many, we should also recognize that providing adequate care for these animals is a societal problem, not just a personal one. Guest authors Taylor Young and Dr. Marcy Sousa provide a public health perspective on pets without veterinary care. Companion animals have long been recognized as having the potential to positively impact human health and well-being. However, pet ownership can potentially have negative impacts, such as transfer of diseases to humans. Proper education and access to routine veterinary services really mitigate the health risks to humans associated with pet ownership. So understanding the role that access to veterinary care plays in the health, not just of the pets, but also their owners, and by extension, the communities where they coexist, is essential to good public health practice and to improving the health for all. Now, long-term private practice owner and coalition member, Dr. Michael Moyer, provides an economic comparison of for-profit and nonprofit veterinary practices. Now, the dominant form of business delivering companion animal veterinary services remains the 1 to 2 doctor, independently owned for-profit veterinary practice. Trends strongly suggest that private veterinary service pricing is outpacing some pet owners' perceived value of service. There's been a historical friction between some of these independent practice owners and perceived or real competition from nonprofit organizations offering veterinary services to the public. The theoretical example presented in this report contrasts two small animal practices whose only difference is the form of incorporation, being either for-profit or nonprofit. It objectively illustrates the financial distinctions between them and gives a sense of proportion to the tax advantage afforded the nonprofit and the financial benefit to the for-profit owner. Now, the study concludes with a robust discussion about access to care in veterinary practice. This discussion by coalition member Dr. Brian Forsgren, who's a private practice owner with a wealth of experience, covers a broad range of issues and attitudes that are relevant to access to care in veterinary practice. He advances the position that the public's ethical expectations mandate that the profession, specifically the veterinary profession, respond to the bigger picture of animal care as the intensification of the human-animal bond continues to expand. Now, veterinary general practitioners are healers, and we think through options that make recommendations based on our education, experience, responsibility to the pet and the pet owner. Moreover, the practicing veterinarian is the ultimate guardian of the integrity of the human-animal bond. The care of the individual patient needs to be broadened to provide a care network that can manage the health and well-being needs of the whole community. The goal of incremental care is to make the animal as healthy and comfortable as possible while preserving the integrity of the human-animal bond. It takes into consideration the quality of life within the socioeconomics of the pet owner. Now, based on the information gathered from the studies and topics presented in the report, specific recommendations made in the report fall into 5 categories. The first is to improve veterinary care services to all socioeconomic groups. The second is to provide incremental care to avoid non-treatment. The third is to improve availability of valid and reliable information to educate pet owners. The fourth is to develop public policies that improve access to veterinary care and pet retention. And the last is other areas of needed research. So to learn more about the recommendations, I would really encourage you to go to the report to read the details. And the link to that report is in the widget. Now, the ABCC report circles around to the paradox of access to veterinary care, which I'll discuss next, and the call for collaboration so that all pets receive some level of veterinary care. While it may seem logical to say that those who cannot afford veterinary care do not have a pet, the reality is many do. Yet it's not likely that their pets will be taken away from them, nor should they be, given the human-animal bond, except in the most egregious circumstances. Are we prepared to take pets away from these families or promote the idea to do so? And if so, where would we take them? So the logic of affordability makes sense in the most simplistic of ways. But in life, things happen. The breadwinner of the family becomes sick, you lose a job unexpectedly, you take in a beloved pet from an ailing relative, your family is severed by the crushing blow of divorce, and the possibilities of unforeseen circumstances that impact one's ability to cover expenses are endless. So hardworking people fall on hard times. So despite sound reasoning, it is a logically unacceptable conclusion. The social paradox challenges the veterinary and social service professionals who want to ensure access to veterinary care. As we do our work to address access to veterinary care, it is important to appreciate the paradox, which can be a barrier in and of itself. Jesse, I think we've got another poll question coming up.
I think you're right, Dr. Krebsbach. Why don't we go ahead and forward to that? There we go. So this poll question is, there should be a compatibility test in order to legally own a pet, or should there be, I should say. So your answers are strongly disagree, somewhat disagree, neutral, somewhat agree, or strongly agree.
And Jesse, just to verify or clarify, what we mean by a capability test is just an evaluation of an individual's ability to pay for veterinary services specifically.
Thank you, Dr. Krebsbach, for clarifying that. I also do want to remind everybody to get their questions in early so that we have enough time to process them in order for a response at the end. I'll give you a couple more seconds to answer. Please answer on your screen and not in the Q&A window. All right, let's see what you guys have to say. All right, Dr. Krebsbach, this looks like our results. What do you think?
Oh, I'm actually very pleased to see that the majority of people strongly disagree. Because first of all, it'd be very difficult to do, and what do we use to evaluate that? And what level do you cut it off? So I'm actually encouraged to see that. How about you, Dr. Blackwell?
Well, I'm very encouraged, and I often think of what does it mean to actually pass laws that denies companionship with pets? I mean, when we think of the health benefits, the love that people enjoy in these relationships, to deny those with very little to start with, that type of relationship just seems totally wrong in my mind.
That's a really good point. That's a really good point. Okay, I think it's off to you now, Dr. Blackwell.
Well, let me just say then that first recommendation that you heard that we've made to stakeholders is to improve veterinary care delivery systems to serve all socioeconomic groups. To do this, clearly one size does not fit all. Underserved families need a system that is more sensitive to their realities. As this image shows, treating everybody equally is not always the fairest way to serve all, because not everyone is equal in their station in life and their capabilities. And so we believe strongly that to improve access to veterinary care, one needs to consider differences that exist across the socioeconomic spectrum of families and have a system that is built with the flexibility to meet the needs of these diverse families. And so our work is to achieve pet health equity. It is occurring in stages. As shared by Dr. Krebsbach, the work of the Access to Veterinary Care Coalition has given us some foundational understanding of barriers families face. Now we are engineering a solution called AlignCare. And I will describe AlignCare and how it helps to achieve pet health equity through time. AlignCare also addresses all of the recommendations made by the coalition as published in the report. An objective of AlignCare, of course, is to strengthen the social safety net. Most programs and activities designed to help struggling families are based on the old definition of family, not the new definition of family. So non-human members are not included in these programs, which include housing, food, healthcare, education, transportation, and otherwise. Through AlignCare, we will weave veterinary care into the social safety net of the nation. One other thing I want to point out about people who depend on the social safety net, we use the SNAP program, the food stamp program, as one lens to give us a size of the problem. And what I want to emphasize here, based on the government's reporting, 80% of the people needing food stamps worked the year before or the year after they became eligible. I guess what we're saying here is we're not talking about slackers here that are looking for a free ride. We're talking about working poor, working Americans who contribute usually in the service industries, much like our own in animal welfare and veterinary medicine, helping others, but also needing help themselves. That's the social safety net that we're referring to here. Given the complex nature of the problem, a One Health approach is really important. Now, CDC defines One Health as recognizing the health of people is connected to the health of animals and the environment. So AlignCare as a One Health system recognizes the health of the pets and their welfare is connected to their families and the people who try to serve them in the communities in which they live. And that the ecosystem of most importance is largely defined by socioeconomics, in particular low socioeconomics. One Health, therefore, is necessary to advance health of our communities by addressing the health of our families and in the case of our work, the non-human family members. This image is a way to visualize the AlignCare One Health healthcare system. People, animals, environment. The people part of AlignCare, the bonded families, are supported by social service and public health professionals, and we're going to go into a little bit more detail about that. The animals, or in this case, these non-human members of the families called pets, are able to receive veterinary care from both for-profit and non-profit providers, and we'll define that further. And their ecosystem, the low socioeconomic or the socioeconomic factors, are addressed through community-based support. We'll characterize all of these further. Another way to look at AlignCare then is, as a system, is that it has 4 essential elements. And I'm going to briefly describe each of these elements, starting with the first one, which is coverage. You should note that in human health care, this usually means that one has health insurance. However, we want to point out that AlignCare is not an insurance program, and it is not based on tax dollars in the case of Medicaid as a human health insurance program. I'm going to touch on each of these now. What AlignCare is, as far as coverage, is through building relationships and collaborations. It's enabling portions of existing resources in our communities to keep pets in their homes. Now, that means what private citizens and businesses and foundations can do in supporting a fund. The fund, of course, exists to pay the subsidies for health care. When I look at this community made up of these members and others, I'm reminded that it is communities that enabled us to reduce the number of pet euthanasias in this country through effective spay-neuter programs, sheltering and adoptions programs, foster care and transport, all resulting in advances in animal welfare. We're simply saying now some of these resources can help in an important area if they are directed to keep the pets in their home. In essence, then, a sustainable business plan would be to balance the finances or financial resources that come through subsidies and what others bring into the mix. This requires that all parties are contributing something. Most families under AlignCare are asked to pay a copay, and that's calculated on a sliding scale. The veterinary service providers are asked to offer their services below the market, but we understand it has to be doable for them. There's only so much that they can give away. And then, of course, companies that manufacture products and supplies likewise have a role in helping to lower the cost, overall cost of such a system. So that, in essence, is the coverage approach under AlignCare. It's doing what we've always done and we're doing every day in many communities across the country, but better managing and organizing those resources to more efficiently utilize them to ensure we keep the pets in the family. The second essential element is, of course, services. And services occur in three ways under AlignCare, those being veterinary care, family support, and education. In the case of veterinary care, AlignCare promotes incremental care, which is clinical care as an alternative to not being able to help the patient or the pet or the family member. It is patient-centered, evidence-based medicine, but in the context of limited resources. It emphasizes prevention and early intervention, and it encourages in-home care when that is appropriate. It certainly differs from gold standard care with respect to diagnostic procedures and some types of treatments, advanced therapies. Incremental care is a tiered approach to case management, utilizing, when appropriate, technologies such as telehealth, telemedicine, and it involves client support, especially when difficult decisions need to be made. And this is a second service area, and that is what social workers, social service professionals, in particular veterinary social workers, are doing to support the families at the time of need. These veterinary social workers are trained in the human-animal bond and can assist, especially when difficult decisions need to be made. Also, counseling is available through this so that we address the mental emotional impacts of that occur when animals that are family members are sick. A beloved family member is sick. I'd like to describe incremental care using this example of a vomiting dog. And it's just an example to give you an idea of what we're saying. This dog vomited 3 times yesterday, otherwise seemed fine, but it's in today. He's been brought in today because he needs to check up just in case. Upon physical examination, check anything going on, temperature is normal, not sensitive in the abdomen, alert, so on and so forth. So an unremarkable exam, if you would. Now, under incremental care, a veterinarian might consider giving a drug to reduce nausea, but that may not even be necessary. Fluids may be subcutaneous. Fluids may be an option, but again, maybe not necessary, and maybe prescribing a bland diet that is prepared at home. That visit is going to generate a cost that's different from gold standard care, which says, okay, in spite of this unremarkable set of circumstances and physical exam, we are going to do blood work and we're going to take abdominal radiographs just in case. And it is the diagnostic procedures that often are responsible for some of the cost of care going up. What we are proposing under AlignCare is that veterinarians use their judgment, and if diagnostic testing is deemed critically important, then definitely it should be done. But if it's not critically important, then not do it in order to make the cost reachable by those who are trying to help. Also, recognizing that a poor prognosis may mean euthanasia is the more loving procedure to perform given the circumstances. And again, the counseling of the family in this unfortunate situation, we veterinarians and our teams have all tried to do this, but we need the help of mental health professionals with some families given the strength of the human-animal bond. Finally, in this area of medical services and social services, AlignCare is organized to manage the costs and service utilization while achieving quality medical care. By counseling the families while they are making tough decisions about health care of their non-human members, social service professionals help them and the veterinary care team. Now, the third area of services, of course, is client and family education and support. Educational services need to be available, and they need to reach a diverse population of bonded families in a culturally competent way. So again, one of the recommendations of the coalition, as found in the report, is improving the educational materials and methodology to for reaching families. The objective, of course, is to prevent health problems from ever occurring. You know, people, when they know what to do and what not to do, that's definitely better than not knowing. And then also addressing these problems early when they occur. Also, it involves managing expectations, especially when we're talking about limited resources. There are just some things that one's station in life basically says you're not going to be able to enjoy. The more wealthy can enjoy some aspects of health care that the poor among us may never be able to enjoy. That's a reality that I don't think anyone can fix at this stage. We certainly cannot. Let me move on from services to the third essential element, and just simply stated, it's timeliness, and timeliness is addressed through pre-enrollment of families and providers, minimizing intake time, especially when urgent care is needed. The fourth essential element, workforce. It's an interprofessional collaboration. AlignCare breaks down the silos that these professionals have traditionally worked within. These independent groups can improve these interdependent groups can improve their missions through formal collaborations with one another. Thanks to Maddie, we are building AlignCare. During the first year, we are researching and developing the components of AlignCare as a system. During the second year, we will demonstrate the effectiveness of AlignCare by implementing it in a number of communities. And during the third year, we will assess and refine AlignCare in order to scale up, reaching more communities. in America. I believe we are ready for a couple more poll questions, Jessie.
Thank you very much, Dr. Blackwell. We are coming up to a couple more poll questions. I believe these are the same poll questions that we had at the beginning of our presentation this evening. So we want to see if any of your answers have been affected during the presentation. So this poll question is, how efficiently are animal welfare resources aligned? Again, your answers are very strong aligned, strongly aligned, somewhat aligned, or not aligned. Please answer on your screen and not in the Q&A window. I'll give you a couple more seconds. Okay, let's see how your answers have changed. It looks like we are still at most people saying somewhat aligned, Dr. Blackwell. Do you have any comments on that?
Well, I did see an uptick. I believe we were at about 67% at the beginning of the presentation, and that's grown a bit. I don't remember where we were with not aligned, but I like the trend.
Very good. And so we do have our next poll question. Again, it's similar to the one we had in the beginning. The poll question is, what is now your single highest priority of the three listed below? 1, increasing the live release rates of shelters. 2, keeping pets with their family. And 3, decreasing euthanasia of healthy and treatable pets. Think about if your answer has changed at all, and then we will go on to see what you all think. Okay, let's see what the results are. Okay, we have 84.5% thinking keeping pets with their family.
That's great. I think we're getting a supportive audience here, Dr. Blackwell. That's great.
Yes, it is. You know, I really appreciate you all sharing your thoughts, your opinion, and answering these questions. And we are pleased to see that there's a bit of movement, meaning that maybe we opened your eyes about some things during this presentation, or at least reinforce some of your thinking. Either way, we believe that your responses reflect where a lot of other people are around these issues, and especially people in the animal welfare field, especially people in shelters. Turning off the pipeline of pets that flow into the shelter when we can keep them with their families. And so thank you so much for participating by sharing your thoughts with the questions. Dr. Krebsbach, do you want to go ahead and
Sure.
add some summary comments?
Yeah, I mean, I think as Dr. Blackwell shared with you, I mean, it's been great to see people understand what a difference it will make with pet retention, keeping pets in their family, which is what we want. And we really feel by doing that, the three-pronged approach of veterinary care, family support, and having a fund to help out those in need will really reach that point of pet health equity. So I'm really encouraged to see, first of all, so many people are interested in this particular subject, and secondly, to see that they understand how we could really make a difference for those pets and their families, because it really are, the pets with their people are really family units.
Thank you. And I would just like to say, I sincerely believe that all pets can receive veterinary care if we as a nation, if we as individuals whose lives are dedicated to animal welfare, if we choose to build a system that reaches all families. We want to celebrate the human-animal bond. We don't want to pass laws that say that you can't have such relationships. It's really un-American, actually. No, we don't want to do that. And we also, I believe, at least, we as a nation are a wealthy nation, especially relative to others. And some would say that what we are generally measuring is a maldistribution of wealth, maldistribution of resources. I ask you to really think about what your role can be and going forward from this presentation in helping to build such a system. We're doing our part, and we certainly ask you to please join us in making this a priority. A priority that all pets deserve access to veterinary care, and it can be a national reality. We appreciate you attending and participating, and Jesse, I believe we will give it back to you or others for the questions.
Thank you very much, Dr. Blackwell and Dr. Krebsbach, for all that wonderful information. We really appreciate all your input. We do have quite a few questions for you guys, so we will go ahead and get started with the Q&A section. All right, I'll be pushing your first question to the screen area. So your first question is, how can we get veterinary buy-in to this concept of incremental care? As a rescue, we already practice this with our animals, but often we see the vets work with our adopters and jump to worst-case scenarios and extreme diagnostics.
I'll take this one, Susan, if that's okay with you.
Okay, absolutely.
It's a very important question, and I would like to first say that we were very encouraged by the national study that found that most veterinarians believe that alternatives to gold standard care should be utilized when there are limited resources. The answer to this question is way more complex than we have time to go into, but let me just say I believe that we have plenty of veterinarians who want solutions, who are willing to be part of a structured approach. Now, that said, I've never met a vet, from my dad to myself to Dr. Krebsbach to all vets. We all practice incremental care because all veterinarians regularly are faced with a patient that they can help, but a client, a family with limited means. And so we are notorious for changing our treatment plans, for shaving our fees. I know it may not look like that to some, but that's a very, very typical behavior among my colleagues and myself. And so what we are seeking to do is standardize these decisions so that ultimately we can get consistency and ensure that it becomes more of a norm, a recognized norm by the regulatory bodies.
That's a really good explanation, Dr. Blackwell, and I'm in 100% agreement. So if we can get to that point of having some standardized way of decision-making, and really, it will be a better way of getting incremental care accepted, not just by the greater veterinary community, but also by liability insurance companies and by the regulatory bodies that you were talking about as well.
All right, thank you very much for both of your input. I have your next question for you. All right, so your next question is, if vets reduce their costs for low socioeconomic population, those costs will get passed on to middle income and rescue groups. So in the end, are there any gains across the community?
Do you want to handle this, Dr. Blackwell?
Sure, I'll
okay.
Take it. What we believe needs to happen is if we take a veterinary service provider for profit, let's say, because this is the context of the question, and this provider is regularly providing care for middle-class families. They have set their fee schedule based upon what it takes to provide care for the middle-class clients that they have. What we're seeking is to recruit and enroll into AlignCare some of these practices who agree to take on AlignCare clients. Now, in this case, they are seeing a new client an additional revenue. It's just that the revenue is not at the same rate as with their other clients. If that is done properly, then yes, these practices should be able to see each year a few AlignCare or enrolled families, and yet not pass on huge costs to other paying clients, and certainly not to rescue groups. I hope that helps, and if not, I welcome a follow-on question.
Okay, anything else to add, Dr. Krebsbach?
Yeah, I was just going to say, so it really boils down to is that we're hoping that we actually bring in more clients to a practice that they wouldn't see otherwise. And that's the whole idea behind AlignCare, is that we can open up those opportunities for pets that wouldn't be seen otherwise.
Okay, thank you very much. We have another question for you. Who would provide the education to the families? I've heard that there are some vet hospitals in Canada that have social workers on staff. Is this what you had in mind?
I can go ahead and answer that if you don't mind, or go ahead.
Well, let me just touch on the social worker part. So the social workers are not to educate clients so much about proper care of pets. Rather, the education is delivered by companies, individuals who are in the business of educating about the proper care of pets. And in the case of telehealth, telemedicine, we're talking about companies that provide such services. So we certainly are not asking the veterinary service provider to educate the client more than would normally occur during a visit and some follow-up. And again, the social workers are there to counsel and to provide guidance, and not so much be the ones educating the client.
And I'll just add to that too, is, as Dr. Blackwell talked about, one of the main components of services in AlignCare is education. So we hope to have a system in place that that the veterinary service provider can go ahead and direct clients to, and also just the public in general. And so, because we do feel that the education is a key component. And I agree with Dr. Blackwell. We look at the social worker involved isn't going to be educating the client on veterinary care, but providing them with an avenue to getting care for their pets. So making them aware of the services that exist.
One other thing I'll say about this, veterinary social work is a relatively new discipline in the field of social work. It was started here at the University of Tennessee in 2002, and our vision in starting what became a new discipline in the field of social work was that at some point in the future, most veterinary practices would either have a veterinary social worker on staff or an affiliation with a veterinary social worker in the community. The point being is, as the human-animal bond has evolved to where it is today, the veterinary care team is not trained or in many ways in a position to support families in their mental emotional health, and yet that's such an area of need. And so the veterinary care team really needs this new professional, if you would, at the table or in the exam room or somehow in the mix, and especially for certain circumstances that come along.
All right, thank you very much for your answers. We have another question along the same line of thought with social workers. I'm going to push it to your slide area. This question says, when discussing implementation with government social services, are you running into or do you have concerns about adding too many tools, i.e. veterinary discussions, to already overloaded social workers?
That's a very good question. I will start by saying AlignCare by design is intended to not add significantly to the administrative load for either social service agencies or veterinary practices, because in both instances, most would probably report that they are overextended. However, what we do know about social service agencies across the country is that all of them have clients, have families that they support, if they're a family support agency. They encounter families that are in need of veterinary care and struggle to help those families with that need. And so they very much, the ones we've talked to, and we've talked to many, really welcome a new option to be able to provide to their families at the time they need veterinary services. With respect to the practices, as well as the social service agencies, AlignCare is going to rely heavily on information technology. So we're building information systems that will allow as much to be done through automated means as possible. So again, not calling on a lot of human input in order to transact certain parts of the business transactions. We are sensitive to the fact that these agencies are really not in a position to have an increase in their workload, but they do want the help.
Yeah, and I was just going to add to that too, Dr. Blackwell. The social workers that I've talked to about this particular program actually get excited because they look at this as being another way that they can help their clients out, as opposed to one more thing they have to worry about. So I have yet to hear one social worker give any negative feedback about having a tool like AlignCare available to them.
All right, thank you very much. Here's our next question. Why do you think that most veterinarians directly go to gold standard of care with lots of diagnostics? Do you think that it is associated with the way the veterinarians are taught in vet school? Is it because of a fear of lawsuits? Or is it because vets think that they increase their revenue that way?
I would say it's all of the above. And quite frankly, the veterinary healthcare industry is very much like the human healthcare industry, because the same question could be asked of that system. I'd like to think that it's not so much to increase revenue, but I have to frankly say that that is clearly a factor in some cases. Recent veterinary graduates are more inclined to practice gold standard care, and some would say that's because that's the way they were taught, that when you see a vomiting case, then you're supposed to take blood work just to make sure, and you're supposed to do x-rays. As an older veterinarian, I can tell you that's not what we always did, that we were general practitioners. We were less reliant upon specialists or specialty medicine. It wasn't really available back in the day. And so the way we practiced years ago was without as much of the diagnostics, because they were not available, or we just were taught to do it differently. So it's a good question, and I think it's all of these factors and probably some others that are contributing. But veterinary medicine is just like human medicine. Healthcare has just gotten expensive for many different reasons.
And one of the things that we did come back with from the study of veterinary service providers is that almost half indicated that they were worried about professional liability if they weren't providing the highest level standard of care. And so I think it's a real concern. But we're hoping as incremental care is accepted more openly, that becomes less of one. And especially as veterinarians get trained specifically in that way of providing care.
I would like to add one other piece of information, because this is such an important question. Well, they all are, but this one is close to my heart because I really it pains me to see where we are right now as a profession. And let me just say that why does it cost more to provide health care? Well, we know that it's not because veterinarians are getting wealthier. So while they may be trying to increase the revenue through some of their decisions, it's not so much going into their pockets or the pockets of the people that work here. Rather, it's the cost of medical devices, the cost of drugs, and of course, when a practice is built that is intended to provide comprehensive care, then that means you've got a number of technologies which are expensive, from X-ray machines to ultrasound and endoscopic equipment and so on and so forth. And it costs more to have a practice that must sustain all of that capability compared to one that is, let's say, built to provide incremental care and then refer. Very different expense models involved there. So I think where the profession as an industry is going to have to make major shifts is, in fact, in this business model where on every corner where there's a veterinary clinic, you see a duplication of all the technologies. We've not worked collaboratively as an industry so that we could control costs. We've duplicated a lot throughout the system. And just changing that will go a long ways toward helping to control costs going forward.
And to add on to that too, Dr. Blackwell, is there's been a lot of airplay about the cost of veterinary education. It's skyrocketing, and many of these students are graduating with hundreds of thousands of dollars in debt, and so that's that's added to the cost of care as well.
Yeah, that's another big one. You know, big educational debt means you have to go to practices that are going to pay a higher salary so you can pay your debt and also pay for your living, cost of living, and all, the whole system is just right now in poor shape, I think, and one outcome of that is the high cost.
Okay, thank you very much for that answer. Also along the lines of cost, we have this question. What role do pharmaceutical companies, who take an ever-increasing bite out of each veterinary dollar, play in allocating resources to the AlignCare model?
Well, our hope is that the pharmaceutical industry will see within their mission, as most of them do, that they have a humanitarian obligation to communities. And most companies find ways to support communities. And in this case, a discount in products that are being used to reach underserved families would help immensely. I believe there are models that would make this favorable for these industries to be able to help. Now, something we didn't touch upon in the presentation, but through time, we want to influence public policy in the nation. And that means changes in tax laws that help to incentivize these small businesses called veterinary practices, and the companies that choose to assist with underserved families. Excuse me. So through time, as AlignCare matures, there will be new ways in which small businesses and big corporations can help with community-based support like AlignCare.
Okay, thank you very much. We have our next question ready for you. How can an organization become involved with AlignCare?
Well, I like the question. At this stage, we will be implementing AlignCare within the next few months in a number of communities. And in that case, in each of those communities, we will be recruiting veterinary service providers and social service agencies who wish to participate. This will be limited in scale because we want to be able to learn something about how such a system can work. Now, within each of these communities, we will have ongoing activities that will facilitate local foundations and community support organizations to build the fund within those communities to pay for subsidies. And so during the study, limited opportunity to participate, but increasingly through time, we will be welcoming all. For the person who asked this question, not knowing what organization or kind of organization you're with, certainly feel free to reach out to us through private mail, private messaging, and we'd love to discuss further your interests and to explore whether there are ways to collaborate with you.
Thank you very much, Dr. Blackwell. We have our next question ready for you. Who manages the AlignCare Fund? Is this a national program? How is this similar or different to private credit cards like Care Credit?
Well, the AlignCare Fund is to be a charity, first of all. It's not a for-profit business model. And essentially, the fund account is, while operating on a national scale, certainly has a community level granularity. And so on one hand, we are needing communities to step up to help their community members in this way, but also manage this on a national scale because some communities have more capacity than others. And the idea is to try and manage the fund account so that we can help the most families possible. But it's not a credit card, it's a charity. The subsidy is a charity. It's essentially like a grant that's offered to cover the care that to offset the copay and the discounted services in order to ensure care.
Okay, thank you again. We have our next question. How do we deal with local veterinarians who feel threatened if we offer lower cost care?
Well, that's a really good question. But I think that the key is that we need to be able to provide services, and we were reaching out to all animals, preferably, and long term, anyways. I think the most important thing is probably education of the local veterinarians to help them understand that we're not stealing clients from them. These are typically people that don't receive any kind of care to begin with, and that we're reaching out to try to help their pets and help the family in the long run. And so I think that the most important thing when dealing with veterinarians that feel threatened is really education. And that seems to be what, at least what I've experienced, has made the biggest difference.
I'd like to add to that by just saying, these small business people probably have a right to feel threatened when there's some competition in the community. If they are struggling to keep the business afloat and keep it going, then, it's totally expected that some would feel threatened. Now, that said, I don't let that stop me from helping someone that they're not helping. Now, and this gets back to Dr. Krebsbach's point about educating. Yeah, on one level, it's helping them to understand this is not your client that's being taken. But also, if you have an option for helping them, hey, we'd be happy to step aside and let you start doing it. Until then, we're going to help them as best we can. And allow that veterinarian to feel threatened if that's what he or she chooses.
All right, thank you. Along the lines of veterinary costs, We have another question. Do you feel veterinary care should be standardized with flat fees for all pet owners? Rates are at a huge disparity and are outrageously unaffordable.
Well, I personally don't feel we can do that. And in a democracy where we are a capitalistic society like we have, we cannot dictate what is being offered by different veterinary, private veterinary clinics. And so that's not even a way that we can go that route. Now, one of the advantages of living in a capitalistic society is that it's supply and demand, right? And so if a clinic offers lower rates and they're able to get more clients that way, then the competition's improved. So I think even trying to take of doing a flat fee type, it's just not possible in our society, nor do I think it should be. And as far as being outrageously unaffordable, I think that depends on the particular clinic. It may depend on your geographic location. And so, and again, we have to remember all the different expenses that every clinic has to go through, which is, and that's why, and it may be, vary from one geographic location to another.
And let me add to that response by just saying, this industry that we're talking about is in transition. Corporate veterinary practices now have about 25% of the market share. Now, where did we come from? We came from a time when you basically had entrepreneurial operations, local small businesses that set fees based on their local economy, and that works, and it works well up to a point. But the industry is shifting, and along with this influx or the corporate entities taking more market share, we're starting to see a little bit more standardization in fees. Now, that's not the same as flat fees for all pet owners, but that is more managed care, which AlignCare is. That is the corporate model, because certain things are measured and sort of costs are controlled through that kind of decision making. But like Dr. Krebsbach, I think the free market enterprise can work. It's not working so well for many families, not only for veterinary medicine, but otherwise, and we just need to adjust it. But the United States is probably not going to go to a national flat fee model for healthcare, and I don't think anytime soon.
Thank you for giving us your input, both of you. We have our next question, which is actually a comment for you guys. I'll come to the screen in just a moment. Since I advise and act as an expert witness for the Texas Board of Veterinary Medical Examiners, I need to point out that care must be according to community standards of care. Less than this must be done with informed consent, or a veterinarian's license may be in jeopardy.
I totally agree. And thank you for clarifying how things are done in Texas. I think that is the standard, and just to be clear, we are not proposing anything that would be different from what you are pointing out is important. I will say that recent court decisions have emphasized that a veterinarian, that first of all, standard care is not defined in the Texas Practice Act or any other state's Practice Act. It's not defined in law. What the law does point out is an expectation that veterinarians will exercise reasonable judgment in patient care, and especially in the context of limited resources, including inability of the client to pay for certain things. And so we think there's room to adhere to these principles that our profession embraces. I certainly embrace, but at the same time, not impose on everyone the high-ticket diagnostic workup of gold standard care when a veterinarian does, under the law, have the right to make a judgment and implement care with informed consent, which is important, in order to control the costs.
And just to add to what Dr. Blackwell said, is I just gave a presentation last night, actually, at Northwestern's School of Law. And with the law students, we talked about the importance of informed consent. So just because a client comes in and is an AlignCare client doesn't mean we don't make them aware of what the different options are. Informed consent is going to be critical. The difference is not only they're going to be informed about these are the different diagnostics we can do, different treatments we can do, but also they're also going to have to be informed about this is what AlignCare will cover and this is what it won't. And so informed consent is going to be critical to make sure that the client is aware of all the different options that are available. And AlignCare doesn't remove that at all. If anything, it emphasizes it even more.
Thank you very much, both of you. Our next question, you may have just given an answer to with your letting them know and informed consent, but I wanted to see what you guys have to say to this person. Would AlignCare participants have a perception that they were getting substandard care?
That's a tough one to answer because we can't really get into the minds of people, but I suppose that's possible, and that's true of any situation, whether they're AlignCare participants or not. But the key there is, I think it goes back to informed consent. As long as the clients are made aware of what the options are, what are the risks and benefits for each different level, and then what's covered by AlignCare and what's not, then they can make an informed consent about which route they go. Dr. Blackwell, anything you wanted to add to that?
No, I think you handled it very nicely, actually. I just will point out that AlignCare certainly is not promoting substandard care. Yep. So while someone may develop that perception, we have to manage that perception through the client communications, informed consent process, and so forth.
All right, thank you very much for your answers to that question. We have our next question ready to go. And this question is, isn't another way welfare groups can help is to publicize the need of a pet or family and collect donations toward helping? Private donors will donate to worthy pet healthcare needs for a single animal.
Absolutely, right, Dr. Blackwell? You talked about how animal welfare organizations can help out with funding specifically as one of the key elements of the workforce.
Yes, I think this is going to be an important factor in whether we as a nation can do a better job of reaching families that are currently underserved. It will involve the need for animal welfare groups to do what you do so well in getting behind and helping with animal causes. I will just point out, especially for this audience, that AlignCare is about more than the animals. It's actually also about the humans. It's truly a one healthcare system. And so we are well beyond just what we can do from an animal welfare standpoint, but also what is done by other organizations on the human side to support families.
Okay, thank you both for your answers. We have our next question ready to go. You may have come across this question before. What about the homeless who cannot afford veterinary care but love their pets?
Well, that was one of the reasons why part of the study was the associated research that Dr. Rachel Chrysler did at Midwestern, is that we want to make sure that we'll be able to address that, that population of people as well. And so certainly they would be eligible for the AlignCare program. and much in the same way, coming through their social service provider.
Okay, that is great to hear. Thank you for answering that. Here's our next question.
One thing I should add to that too, and Dr. Blackwell, I apologize if you mentioned this, but when we talk about the co-pays, it is going to be on a sliding scale, and so definitely that would be taken into consideration when being part of the AlignCare program.
All right, thank you for that extra comment. We do have our next question ready on the screen. What are the qualifications to be a veterinary social worker? Is this a recognized degree?
It certainly is a recognized degree. As I mentioned, it's a recognized new discipline and has been embraced globally. Veterinary social workers start out as individuals in the social work curriculum, but through time they, of course, increasingly study about the human-animal bond. And the University of Tennessee is granting graduate degrees, actually, in veterinary social work. Also, if you Google veterinary social work, you will get right to the University of Tennessee website. It's the first thing that's going to come up. And you'll notice that there is now a certificate program. So social workers who did not train in veterinary social work can now earn a certification in veterinary social work. And in the very near future, that certificate program will be expanded to be available to veterinarians, veterinary technicians, or nurses, and others. So it is a qualified, recognized, degreed field of study.
All right, thank you for that wonderful information. We have our next question. How does AlignCare finance itself?
Well, whoever asked that question is with your help. Actually, to build AlignCare, of course, we were fortunate to have Maddie, through Maddie's fund, fund the work of figuring out how a system like this can work. But as far as the actual funding of the healthcare, this is what we are looking to communities to get behind. Now, take the community I'm in right now, a certain number of resources over time have been directed at spay-neutering and foster care and so on and so forth. In some communities, especially in the Northeast, the shelters are not as crowded anymore, and some of the resources can shift toward keeping the families together, keeping those pets in their home. And so the funding comes out of private sources. We think that the checkout charity model is going to be very important, meaning as more and more businesses allow their patrons an opportunity to help their community at the time of checkout by rounding up, a lot of revenue can be realized that way. This is in addition to what foundations and other organizations can do. There are some big foundations that utilize the checkout charity model. I guess the PetSmart Charities is the largest, and I think they are reporting more than $50 million in revenue through that model in 2017. So just to think of businesses within a community that's, I guess what we're saying is if we facilitate the compassion of people in our communities who want to help animals and help these families, then the money will flow into the system to pay for the healthcare costs. We have to build a way for that compassion to be expressed. Sorry for the long answer.
No worries at all. So this will be our last question for the evening. We're sorry we're going a little bit over. We hope all of you are staying with us. I'll push the last question into the slide right now. Would AlignCare cover preventable conditions like parvo treatment and pyometra?
As a matter of fact, AlignCare is very much, into preventable conditions, and so vaccines are very important. Stays and neuters prevent, pyometra and things like that. Absolutely, we see that. That's a big part of incremental care is that we want to, if there's things that we can prevent from happening, we certainly want to pursue that.
Okay. Anything else to say, Dr. Blackwell?
No. My soundbite and what Dr. Krebsbach just said is one way to lower healthcare costs overall is to prevent problems and to address them early.
Right.
It's waiting until a patient is sicker and sicker and needing more advanced care that's part of the problem. So we very much have a bias toward preventative care and early diagnosis and intervention and treatments.
All right. Thank you very much, Dr. Blackwell and Dr. Krebsbach, and all of you for sharing your time with us. I know we did not get to everybody's questions this evening. You can ask it on the webinar forum for this webinar. We invite you to join an online discussion about this and other webcasts on Maddie's Pet Forum. Watch for announcements of upcoming webcasts and find more free educational opportunities on our website at maddiesfund.org and on Maddie's University at maddiesuniversity.org. Again, thank you for joining us.